So for those of you who I have not met, my name is Elizabeth Bynum Sorrell, and I am the researcher with the Digital Benefits Network. It is my distinct pleasure to be introducing a series of short lightning talks on innovative ideas, approaches, and pilots to better understand and improve benefits delivery in the US. On this slide, you can find a QR code and link to our speaker bios. And first up, I'd like to welcome Jeramia Garcia Ramadan, the Director of Governance and Innovation at the Arizona Department of Economic Security. Today, Jeramia will be sharing about DES's unique perspective on benefits delivery and how that is driving innovation for the agency, their workforce, and their clients. All right, Jeramia.
Hello, thank you so much. Good morning, everyone. Just want to say a big thank you to Elizabeth and Chanel and Ariel and everyone at the Beeck Center and the sponsors for putting on BenCon. It's already been such an incredible experience, and I'm really thankful for the opportunity to get to speak to you all today. As Elizabeth said, I'm Jeramia Garcia Ramadan. I also go by Jeremy in case that throws anyone off. And I am here from the great state of Arizona to give everyone a state perspective on improving benefit service delivery. I do want to say a special good morning to those in Arizona that signed on pre-8 a.m. To hear this talk. Thank you so much. And for those of my team that are listening, really thank you. Everything that I'm going to talk about today is obviously you all driving. So just to introduce a little bit about the Arizona Department of Economic Security. Many of you may know that we are a very large human service agency administering over 60 programs. We are uniquely positioned in that we are one of the very few states that have our traditional human service safety net programs housed within the same department as our workforce programs, like unemployment insurance and the WIOA programs. Leaders from our organization conduct strategic planning together. We problem solve together. We literally sit side by side administering these programs. So we are uniquely positioned to innovate and improve service delivery across the spectrum. During the pandemic, we both managed the unprecedented number of claims for unemployment insurance while also implementing pandemic nutrition programs, all while ensuring that we protected the most vulnerable populations in Arizona, such as individuals with developmental disabilities. That experience has only strengthened our clarity on the unique role that we can play in improving benefit service delivery. We are well positioned at DES in Arizona to be an incubator for the compassionate, fiscally responsible innovation we need in government. So I want to start to just orient you on some of the challenges and opportunities that we're able to see at DES in our service delivery. As I said, we have over 60 programs, but many of our clients interact with a variety of our programs and face, varying eligibility criteria. There's considerable overlap and duplication and very little streamlining happening at all levels of government, and really even less interagency and interdepartmental interaction that we see. Staff on the front lines must train to and manage this complexity while dealing with compassion fatigue and secondary trauma. And because each program is so complex, the rules, the eligibility, the requirements, staff cannot become experts in the breadth of human service programs. So there has to be all of this additional infrastructure that's created to support this complexity at the federal level, at the state level, at the local level, at the tribal level. Additionally, we are working with aging technology, legacy mainframe systems that make it very challenging for us to make changes for innovation or even for law changes and regulation changes. There is also a focus on activities rather than outcomes. I don't mean to call out our federal partners, and I am a former Fed myself, but really there is a focus at the federal level on timeliness and accuracy of point of contact benefit or service delivery, rather than on what those activities really mean in the lives of the people that we serve, which necessarily means that we are incentivized at DES to design our program to those metrics. This is changing, and I was actually really excited to see within the Fiscal Responsibility Act, the TANF outcome measures language. I'm really excited that there is going to now be this push for focusing on outcomes. The structure at DES means that we're acutely aware of the silos between programs, and we hear every day how incredibly frustrating it can be for people we serve. Arizonans do not live in silos, but they are required to navigate sometimes confusing, conflicting, inefficient program requirements to obtain the services they need to live their best lives. I'm introducing our team because I know many of you have teams within your organizations that have been created to do something similar, and I'd love to partner and have dialogue with you all. But the Governance and Innovation Administration was created in 2021. We are focused on improving client outcomes and employee engagement, modernizing governance and service delivery, and introducing policy and process efficiencies, innovations, and cross-divisional alignment. My team's real purpose is to serve as the model at the enterprise level for how strong governance structures can actually create the room for innovation and to build that capacity across the policy teams and governance teams across the department. I'm so grateful to my team in Arizona for building this support and infrastructure at DES. I'm also lucky enough, because of this administration and what we've created, is to have space within our department to think deeply about challenges facing our systems and the people that we serve. This deep thought work has allowed us to create structure around understanding and improving the interconnectivity of all of our programs, understanding how pulling the levers in one area can substantively impact the outcomes of clients in many areas. One of the projects our team is working on is an eligibility matrix. And this is probably exactly what it sounds like. It's a matrix that catalogs the eligibility requirements of DES income-based assistance programs. And we are defining eligibility requirement as any requirement that would cause a denial of benefits. We're hoping this project allows us, and it has actually allowed us, to compare, contrast, and analyze eligibility requirements of DES income-based assistance programs in order to identify areas of opportunity across those programs. We are trying to use this matrix to ask questions such as, can we, DES, better advocate for eligibility decisions that lead to meaningful outcomes for the clients and reduce the regulatory burden for those clients and the state? Can we align DES assistance eligibility requirements across our programs to better and more efficiently support the family's goals? For example, which of our income-based assistance programs require that a dependent child be in the household? How many applications do you have to fill out? Which programs have an employment requirement? This confusion can be a barrier to services. Here's an example of some information coming out of the matrix. It turns out that there is no one way that we define the group of people that is considered when applying for a program. So the family, but what does that matter, right? Why does it matter that Medicaid uses budgetary group while TANF uses family assistance or assistance unit? Well, the way that we define this one term often determines whose income, assets, employment are counted towards eligibility and determines who is essentially eligible for benefits. Analyzing how and where these terms are used and streamlining where appropriate and allowable will lead to policy and rules that are more clear, concise, and understandable, and thus can be implemented in a more effective, efficient manner. Additionally, streamlining the use of these terms supports the longer-term goal of streamlining the application process, where a family in need of support is not treated differently in different programs. Additionally, in Arizona and across our nation, we have multi-generational families. We have congregate residential settings. We have tribal communities that all introduce a beautiful nuance to the term family. And they hit barriers in accessing services because of the way that we define family across our programs. I'm really excited about the potential of partnering with the DBN to see how rules as code might be the next step in our journey to reduce the complexity for the families we serve and the staff that are serving them. So going back a little bit to what I said around our aging IT, in 2020, we had a consultant come in and analyze the DES application portfolio to understand the business fitness and technical quality application infrastructure. This data is somewhat dated, obviously, going back to 2020, and there has been some movement, but this still provides a decent approximation of current state at DES. So according to the consultant, 44% of the applications in our portfolio, so less than half, are in a sufficient condition to warrant continued investment. Another 16% have reasonable technical quality, but weak business fitness. Those are the ones we tolerate. And 40% of the application portfolio requires immediate replacement due to technical deficiencies. We need to migrate it to a new platform, or both technical and business deficiencies, meaning we just need to eliminate it altogether. Many of our business processes are paper-based manual processes that require re-entry of data across systems, obviously reducing productivity and delaying the time to benefits for clients. And it's really expensive to maintain, including introducing redundant capabilities. There's also definitely a challenge with skills, as there are talent gaps across the infrastructure. So what are we doing about it? Like many states, our tech roadmap includes modernizing our systems. So the UI system, our rehabilitation services system, our child support system, all are going through modernization projects. But we're also creating a client portal that will provide one point of entry for our clients across our programs, and hopefully taking from some of what we heard earlier on the panel and not trying to bite off the whole project, but take it in little increments. We really want to move the relationship between our staff and clients from transactional to relational, and we want our tech to support that vision. At the same time, we want to avoid or at least mitigate the unintended consequences of modernization. We're contemplating how to get meaningful feedback from users at all points in the design process, and to ensure that we are compensating those users for their time and thought work. Several BenCon participants have helped me think of really innovative ways that we can be doing this, the way that we describe that compensation and how we don't impact other benefits that they may be receiving. We're also conscientious, oh my gosh, I can't talk. Sorry about that, guys, of who is going to be able to access digital benefits, and ensure that our state's digital equity plan is seeking to address gaps, and that we continue to offer an array of service modalities, including physical offices. As we heard earlier today, that's not going away, and that's not our intention. We want to prevent people from being left behind on our modernization journey and be modernizing in all service points of entry. So thank you so much for your time. My goal here really was to tell you a little bit more about what we're doing, because if you're doing something similar, or if your organization supports this work, please reach out to me. I neglected to leave my contact information on here, but I have business cards, and I'm sure anyone on the BenCon team would be happy to connect you. I'm really hoping that I can leverage relationships here to improve what we're doing in Arizona. And I just wanted to leave with one final thought. Really, the complexity of our programs is a barrier for both the people that we serve and the staff that are on the front line supporting those families and individuals. Innovation for staff must happen, or we will not get innovation for our clients. Thank you again, and I hope you all have a wonderful day.
All right, thanks so much, Jeramia. Next up, I'd like to introduce Sarah Esty, Senior Advisor for Technology and Delivery at the U.S. Department of Health and Human Services. In her role, Sarah co-leads the Facing Financial Shocks initiative to help states deliver the full set of public benefits. Today, she will be sharing about that work. Welcome, Sarah.
Thank you. So it's great to be here with all of you. To talk about work that got kicked off about 1.5 years ago with the signing of the Customer Experience Executive Order in December 2021. And that executive order laid out a strong federal priority around improving the service delivery of core benefits. And it both challenged individual agencies that work directly with the public, programs like Medicare and Social Security, to make sure they were doing the best job they could in making it easy to access benefits. They also challenge groups of agencies that together need to deliver benefits to people at times of need where that surpasses anything a single agency can do to work better together. And so that resulted in the creation of 5 interagency life experience teams. Ours is around facing financial shocks, which is thinking about how to streamline service delivery for low-income families facing the loss of income of up to $400 or increased expenses. And when that happens, people need fast, easy access to benefits so that they don't end up in a downward spiral of having to take out a payday loan, maybe losing a job because they can't fix their car to get to work, those types of things that can really knock people out and start a downward spiral. And so we started with the goal of saying, what would it take so that people know the full set of benefits they're eligible for? They can apply to that full set of benefits in 20 minutes. They can get their determinations back in 24 hours. They only need to submit their data once. They can start accessing the benefits within a week, and they can stay enrolled as long as they're eligible. So that's our North Star. We know that that is actually almost here in a couple states and some programs, and that is very far away for other programs in other states. So we began with talking to people going through the system to understand the pain points and experiences they were having, and heard about the challenges they face in the upfront enrollment and access for those services, long processes to apply, interview requirements, waits to hear back, no updates on their cases. We also heard about challenges using their benefits, staying enrolled, meeting program requirements, staying enrolled at renewal, and not being able to use benefits for the things that they needed. And then finally, we've heard about transition challenges. So you hit a benefits cliff and can't actually get to stability. You have an asset test that doesn't let you save, and that makes it hard to ever leave a cycle of poverty. When our team sat down and thought about which part of the process we were going to focus on, we were pretty realistic about the things that an interagency federal team can do without major amounts of new money and major changes to legislation. And so that really honed our focus into that first bucket around access. So then we went out to talk to states and to understand they're trying to run most of these programs well. The vast majority of states want these programs to be a good experience, easy for people to access, and not a huge burden on their staff. And when they try, there are so many challenges they face that lead to a lot of the pain points we heard from people. So there are complex, conflicting federal policies with different definitions and different requirements across programs. There are silos around how you can use funding, how you can run your operations, how you run your tech systems. They often don't have the people that they need. They may not have service designers. They may not have tech product managers. They may not have people who don't have a day job and have the flexibility and the time to work on new innovative solutions. There is also a compliance orientation where the federal oversight and supervision and the messages they get are all about program integrity and following the rules. And we rarely talk about the dignity of the person going through the benefits process, the ease of access of that person, the timeliness of delivery. We are not holding them necessarily accountable for those things. And so that is not what they focus on. And we also know that there is real inequity and unevenness across geographies and demographics. And some of that is funding differences. Some of that is systems that were designed for certain types of people that are not serving everyone well. But we also know there are ways to make this work better. And I had the privilege of serving as the policy director in Michigan at the Department of Health and Human Services while they were undergoing a major transformation of their benefits delivery system, and got to see firsthand what that looks like when you overhaul a form, you overhaul a business process, you really think about training and delivery for caseworkers and how they are delivering services at the front lines, and what it looks like to have real change champions at all levels pushing for this work. So we've identified about 9 different things that we think you will want to have in place for a successful benefits program. From the front end applications, streamlined, redesigned, multi-program and multi-channel, including mobile first responsive design for your online forms, plain language notifications and outreach mechanisms that are also pushes at useful touch points, a culture of access and human-centered design from all angles of your delivery system, including embedded into what you're holding staff accountable for, data-driven determinations and renewals, and strong back-end data systems that give you the data you need to do that automated and expedited processing, harmonized policy and legal frameworks that do find ways to bridge different programs into a single application, single casework, or single determinations that resolve privacy and consent issues and that make the whole system work. Streamline business processes, so actually revamping the caseworker process for doing eligibility determinations and applicant and renewal experience from the perspective of the beneficiary. Emphasis on a talent strategy for caseworkers and frontline workers, as well as your tech and data staff. Effective digital services procurement and IT system management, because if your backbone systems are not working well, the whole thing is going to be very hard to do, no matter if you do everything else. And then finally, you're going to need a leadership commitment to make all of these things happen. And there are excellent best practices out there across the country in each of these. And there are very exciting places where many of these building blocks are together at once. And that is the truly catalytic outcome, is when you can put a number of the puzzle pieces together. So what is our theory of change for our team? First, we want to figure out how to lower the barriers to entry for states to replicate best practices, highlight those best practices, pull out the replicable elements, and then help the states adopt them. Second, we want to innovate to create new solutions where the models don't exist or aren't working well. Third, we want to build dedicated multi-program delivery capacity at the state and federal levels. This work will get done when there are people and money to do the work. And without that, it's really hard to build and sustain. And then finally, we need a culture change. And that is a federal culture change, a state culture change, and an ecosystem-wide commitment to say we are valuing ease, dignity, and access in our programs. And think about what that looks like at every level. So how are we actually turning that theory of change into practice? So first, we're trying to identify and bless effective state models. And that's why we're so excited to be at forums like this, where we get to hear directly from you, state leaders, local leaders, technical assistance partners, nonprofits, folks convening and funding this work about what's working. We're working to publish plain language guidance. So a couple of weeks ago, we helped organize a training for the Federal Communications Commission with over 400 state and local leaders to hear about the legal ways to do text messaging for benefits delivery. And so it's things like that that say, yes, you are allowed to do this, and we are going to get the right people in front of you to give you that permission. Then we're thinking about how to deliver technical assistance on multi-program operations. And a lot of the federal government is really more focused on policy and regulation. And so this is a new approach to think more about what does operation support and multi-program operation support look like. Finally, we're thinking about developing modular tools, templates, and service offerings to think about those building blocks we talked about and how we can help advance each of those, but also make sure they'll fit together at the end. On innovation, our 2 main areas of focus are equitable and automated income verification services. And we know that this is a huge possibility if we can better help states access existing federal and other data sources to do easy income verifications. And we also know that this is not a place that has worked excellently in the past, and so that there are more opportunities to do better and to expand. And the federal government has a unique role in being able to convene, coordinate, and support states in doing that. Second, working on procurement and IT vendor management. And that is probably a thing you may have experienced or heard about as a major blocker. It is also one that we continue to hear there are not great models and examples. And so we want to do more research with all of you to understand maybe there are models that haven't been lifted up, or let's roll up our sleeves and try some new things together. We have been able to do this because we've established a federal multi-program benefits team, the State Benefits Accelerator. So we have folks able to work on these problems day in, day out, to work boots on the ground with states, to work at the federal level on these innovation teams. And we also are working on external partnerships to get support for our state partners. And that is thinking about peer learning opportunities, technical assistance opportunities, funding and philanthropic support, and capacity building and training for states. And all of those will help make sure we have the right people to do it. And then finally, culture change. So first, the executive order is the start of that culture change. It is the federal government coming out and saying, we value this and we are going to invest in it. It is the recognition that you need a whole person, multi-program, de-siloed approach, the creation of our interagency task force and team to work together. And we have meetings about every month with the senior leaders to bring them in a room and think about how we are delivering for people, not each of our programs alone. It is resetting the state-federal partnership so that we are committed to listening to states, to having forums like this for two-way dialogue, and to co-creating and testing out solutions together. And finally, it is that ecosystem-wide collaboration where we come together and say, we cannot do it all alone, you cannot do it all alone, but let's think together about the roles that each of us can play in delivering the benefits the way that people deserve to have them delivered. So thank you very much, and I look forward to future opportunities to work with all of you.
Thank you so much, Sarah. Finally, I'd like to welcome Georgetown's own Dr. Pamela Hurd, Professor of Public Policy at the McCourt School. Professor Hurd's research focuses on inequality and how it intersects with health, aging, and policy. She is the co-author of the book, Administrative Burden, Policymaking by Other Means. Today, she will be sharing about a new tool to measure burden in public programs. Welcome, Pam.
I'm excited to be here. If there's nothing else, I'm always excited to talk about administrative burden. Okay, so what I actually want to talk to you about today, though, is, you've been here kind of talking and really thinking about effective service delivery. And so what I want to talk to you about is a tool that I'm hoping will help us to better evaluate whether or not we're effective at service delivery and whether any kind of improvements we make actually work in practice for the people receiving those benefits and services or trying to access them. So a big part of effective service delivery is whether or not people experience that process as simple, accessible, and respectful. Or do they experience that process as burdensome? Does it feel onerous, complicated, confusing? It sucks my time up. And so that part of the process is really important, trying to understand whether or not people experience the process as burdensome. This is a kind of precise way to measure it. And part of the reason to do this, part of the reason to have a precise definition, is because it's really hard to both identify a problem and provide solutions to a problem if you can't clearly define it, right? So the way that we think about it is in terms of a series of costs. How do we define these kind of onerous experiences? They entail learning costs, the process of figuring out whether or not, for example, you're eligible for a benefit, how to apply for it, that part of it. Compliance costs, which are everything from complicated forms or crashing websites for the folks in this room, to the time costs involved in actually trying to access those benefits and services. And finally, the psychological costs, which are the kind of stress, frustration, anxiety that people can feel as a part of those processes. These categories are useful both, again, in terms of defining what kinds of problems you might have, as well as thinking about appropriate interventions. An intervention that's really good at addressing learning costs may do nothing at reducing compliance costs, for example. This really matters, and this is salient in terms of thinking about administrative burden, in part because the executive branch, and particularly the Biden administration, has made clear that this is a priority through a series of executive orders, agency guidance around the Paperwork Reduction Act, and agency directives. So the goal increasingly for folks delivering federally funded benefits and services is that they have to start thinking about how to reduce administrative burden in the delivery of those benefits and services. And one thing I want to kind of make clear about it is how extensive this is. This effectively will touch nearly anyone living in the US. So if you're a veteran interacting with the VA, if you're trying to get your passport, if you're trying to apply for a green card, if you're over the age of 65 pretty much and receive Social Security benefits. Basically, every individual in the US is probably touched in some way or should be touched by this executive order. So it's big, the magnitude is large. As a part of this, right, and I think we're seeing and hearing a lot of people in this room actually doing this work, we're trying to reduce burdens in these programs and do interventions. And the question is, though, like, we need to be able to evaluate like whether or not they're working. So how do we do that? How do we evaluate that? So with funding from Schmidt Futures and sort of in collaboration with work that we're doing for Code for America, we tried to develop one approach at least to kind of evaluating how effective burden reduction is and the level of kind of administrative burden in public programs. So I'm going to just talk a little bit though about what we were trying to do with this and what priorities were that drove like how we generated this measure. So the first is, there's two things we can think about. We can measure outcomes, how much time a process takes, how many forms people have to fill out. Really important, in part because they're kind of relatively objective. And also you don't necessarily have to bother people receiving benefits or trying to access benefits or services to get that information. But people's perceptions matter as well. How they, in fact, experience that process. You may shave off 30 seconds in a process, and that's important, but people may not actually notice, and it's important that we're aware of that so that we understand it's not just like one intervention, but it might be a cumulative process. Like once I've done 6 burden reduction efforts, now people start to really feel it. And that feeling really matters because it affects how we actually perceive whether or not government is helping us, whether or not we should trust government to deliver these services, right? So yes, the objective measures matter, but we also want to understand how people perceive that process. So we wanted to do a kind of perception measure. The second thing is we wanted something that wasn't burdensome, right? We don't want to have people, go through a process and then spend 20 minutes filling out a survey for us, right? Like they will experience that as burdensome and it kind of defeats the point. So you need something short, simple, and something that's easy for people to understand. The final part of this is that we wanted something, there's different ways to talk about this in academia or in economics. You talk about this as a public good. I think in the tech community, you think about this as open source. But basically what we wanted to do also was create a measure that like anyone can use. Anyone in this room, any agency, any nonprofit, like you can just pick it up off the shelf and use it yourself. And a few parts of this, we wanted to do it so that it was like adaptable, a measure that you can alter slightly to fit the particular needs of your program or your organization. But partly what we wanted people to understand is good measures are actually not easy to create. It does require an investment of time, testing, and a process to make sure that you have a measure that actually works pretty well and that people understand. So we wanted to kind of do that work for you. So I'm going to just put the measure up here. But what I want to kind of say about this is that the group that developed this measure here at Georgetown, the Better Government Lab, we do have a working paper that I believe is already accessible via the website for this conference, but I'm happy to share it. We're also happy to chat with folks individually or organizations or groups individually if you want to use the measure, if you want to adapt these measures. We're happy to kind of work with you actually on that to kind of help folks with this process. But the last thing I'll sort of say about this is what we did was we kind of developed like a 1-item version, and then we developed a 3-item version, basically. The 1-item version honestly works pretty much as well as the 3-item version. And the reason why we really make this point about short and accessible is precisely because what you'll find, and we know this, there's a load of empirical evidence to support this. If you ask people a single question, they'll probably answer it for you. You ask them more than that, fewer and fewer people. And the fall off between one question and then after can be really significant. Why does that matter? It matters basically because ultimately, if you ask people a ton of questions, the person who actually does that for you is going to be really different than everyone else that you're trying to serve. So it's great. It is so tempting to 20 measures. I want to know all these things. It's so tempting. But the reality is you'll undermine your overall goal, which is to sort of on average understand how people are experiencing the process. So thank you for giving me the opportunity to chat about this. Please feel free to contact me. And we're delighted to have people use this. And so we're happy to chat with you more about it. Thank you very much.